Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Carotid Artery Disease. Introduction. The buildup of substances in the two biggest arteries in the neck can limit or block the supply of blood to your brain. This is known as carotid artery stenosis or carotid artery disease. Clogged arteries in the neck may lead to strokes. This program will help you better understand carotid artery disease. It talks about its causes and complications. It also explains how carotid artery disease is diagnosed and treated. Symptoms and their causes. Blood vessels in the front of the neck called carotid arteries deliver blood to the brain. Carotid artery disease may limit blood flow to the brain. Carotid artery disease usually does not cause any symptoms in its early stages. People usually do not know that they have a problem until they have a stroke. Strokes happen when the brain does not receive enough blood. A sudden drop in the amount of blood getting to the brain may cause a little stroke, also known as a TIA. TIA is short for transient ischemic attack. Symptoms of a little stroke, or TIA, may include numbness, weakness, and difficulties with speech or vision. These symptoms last for only a short time. Strokes happen when there is a loss of blood to the brain for a longer time. The resulting brain damage can cause a loss of speech or a loss of coordination. This may require hospitalization. Large strokes can also result in death. Around 1/3 of the people who have had a little stroke, or TIA, go on to suffer a more serious stroke. If an artery is clogged, blood cannot get to the brain. Healthy arteries have smooth walls. Smooth artery walls are common in children and young adults. The arteries can get clogged with plaque, which consists of cholesterol, debris, and other materials. As the plaque layer thickens, enough blood cannot get to the brain. This condition is called hardening of the arteries. A small piece of plaque may break loose from the artery wall and float up to the brain. This piece may flow into and block a smaller artery in the brain, causing a stroke. Diagnosis. Since carotid artery disease usually does not cause symptoms in its early stages, regular visits to your healthcare provider are important in catching problems early. Signs of carotid artery disease can be found during a physical exam. These signs include a whooshing sound, called bruit, coming from the carotid artery. Pieces of cholesterol in the blood vessels in the back of your eye. Your healthcare provider may do a Doppler ultrasound to check the arteries. A Doppler ultrasound uses sound waves that bounce off blood cells to create a moving picture of blood flow. Sometimes a CT scan or MRI is used. CT or CAT scan stands for computed axial tomography. MRI stands for magnetic resonance imaging. These tests create pictures of the carotid arteries to look for signs of a stroke or other problems. Your healthcare provider may order radiological tests that use special dyes that are injected into the arteries. These dyes make the arteries visible in the pictures taken. These tests may include MRA, or magnetic resonance angiography, CT angiography, or CTA, which stands for computed tomography angiography, cerebral angiogram. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Treatment options. If the blockage in the carotid artery is mild, your healthcare provider may recommend changes to your lifestyle to prevent further blockage and stroke. Changes to your lifestyle include not smoking. If you smoke, quit. Eating a healthy diet that is low in saturated and trans fat. Being active and exercising regularly. Other lifestyle changes include cutting back on salt, controlling your blood sugar if you have diabetes, keeping your blood pressure at a healthy level. Medications can also be used to help treat some cases of carotid artery disease. Medications may be prescribed to lower blood pressure, lower cholesterol, prevent blood clots. Your healthcare provider will discuss with you what medications are right for you. Do not start any medication regimen without discussing it first with your healthcare provider. This includes over-the-counter medications. If medications and lifestyle changes alone cannot control or treat your carotid artery disease, then surgery may be needed. Carotid endarterectomy is the most common surgery recommended to treat carotid artery disease. During this procedure, the carotid artery is opened through an incision in the neck and the plaque is cleaned off the artery walls. Sometimes a carotid endarterectomy is not possible and an angioplasty with stenting may be done. During an angioplasty, the artery in the neck is unblocked and opened using a balloon. A stent is then placed to hold open and support the artery. This is usually done through long catheters threaded in the arteries. This type of procedure does not involve a neck incision.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Carotid artery disease happens when substances build up in the arteries in the neck. This can limit or block the supply of blood to your brain. When blood supply is blocked from the brain, it causes a stroke. Strokes can be dangerous and even deadly. Your healthcare provider may do a physical exam and some radiological tests to help diagnose carotid artery disease. Treatment options may include lifestyle changes and medication. In severe cases, surgery may be needed. If you have any questions about carotid artery disease, make sure to ask your healthcare provider. Thank you for using Explain.